Welcome to Evidence Mastery with Dr. Massoud Toussi. I am going to help you understand what multiple sclerosis is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice. So let's talk about multiple sclerosis, or MS. It's a condition that touches millions of lives across the globe. And yeah, it can seem really complex, even unpredictable. But the good news is, over the last few decades, our understanding, it's taken a giant leap forward. And so has our ability to manage it. So let's dive in and build our understanding together, right from the very beginning. All right, so here's our game plan. We're going to start with the basics. What even is multiple sclerosis? Then we'll get into the why, the causes, and what's happening inside the body. After that, we'll look at the symptoms and the different ways the disease can show up. From there, we'll cover how it's diagnosed, talk about the amazing modern treatments we have now, and wrap up with the prognosis, what the evidence really tells us about the road ahead. Okay, let's jump right into section 1. So what's actually going on inside the body when someone has MS? Well, at its very core, it's a condition that affects the central nervous system. And when we say central nervous system, we're talking about the command center, the brain, and the spinal cord. So here's the key thing to understand. MS is what we call an autoimmune disease. What does that mean? Well, basically, the body's security system, the immune system that's supposed to fight off germs, gets confused. It mistakenly starts attacking its own healthy tissue. And in multiple sclerosis, the specific target of that friendly fire is something called myelin. Think of myelin as the insulation around an electrical wire. It's this fatty, protective coating on all your nerve fibers. And when that insulation gets damaged, the electrical signals, they can get slowed down, scrambled, or even blocked completely. That's the fundamental problem. So that, of course, brings us to the big question, right? Why? Why does the immune system turn on itself like this? The truth is, we're still putting all the pieces of that puzzle together. But what the evidence strongly suggests is that it's not just one thing. It's a really complex dance between a person's genetics and their environment. Yeah, it's not like there's a single MS gene or one single trigger. It's more like a perfect storm. It seems to happen when someone who has a certain genetic susceptibility runs into the right, or I guess the wrong, environmental factors that kickstart the process. And this is a fantastic way to visualize what we're talking about. Look at the healthy neuron on the left. You see that smooth, thick myelin sheath? That's your high-speed internet cable, letting nerve signals zip along without any problem. Now look to the right. That's what happens in MS. The immune system has attacked and stripped away parts of that myelin insulation. Those damaged areas are what we call plaques or lesions. And it's that disruption, that short-circuiting, that leads to all the different symptoms of MS. So when we talk about that perfect storm, what are the factors? Well, the evidence points to a few key things. On the genetic side, there are certain markers on our immune system genes, like HLA-DR2, that seem to make someone more prone to developing MS. Then there's the environment. We've known for a long time that MS is more common the farther you get from the equator in more temperate climates. This might be connected to lower vitamin D levels from getting less sun. We also see a really strong link to certain viral infections, especially Epstein-Barr virus, the one that causes mono. It might act as a sort of trigger. And finally, some lifestyle factors play a role too. The evidence shows that things like cigarette smoking can increase the risk. And to give you a sense of the scale here, we're talking about an estimated 2.8 million people worldwide living with MS. It's a major global health concern. And typically, it's diagnosed in younger adults, usually between the ages of 20 and 40. And it does affect women significantly more often than men. All right, let's move on to what this all looks and feels like. A really crucial thing to understand about MS is that because it can strike anywhere in the brain or spinal cord, the symptoms can be incredibly different from person to person. I mean, it's often said that no two cases of MS are exactly alike. The disease also tends to follow a few different patterns as it progresses over time. So here you can see the main ways the disease can play out. By far, the most common pattern, especially at first, is what we call relapsing remitting MS. This is where someone has clear attacks or relapses, where symptoms flare up, followed by periods of recovery or remission, where things get better. Now, for many people, this can eventually shift into secondary progressive MS, where the disease starts to cause a more steady worsening of function. A smaller group of people have primary progressive MS right from the get-go. For them, it's a slow and steady progression of symptoms without those obvious relapses. And that last one, progressive relapsing, it's a rare category that we don't really use much anymore. And the symptoms themselves? They're a direct map of where the damage is happening. So for example, if a lesion forms on the optic nerve, which connects the eye to the brain, you can get something called optic neuritis. often painful vision loss in one eye. If the damage is in the spinal cord, that might show up as numbness, tingling, or weakness in an arm or a leg. And then there's fatigue. This isn't just being tired, it's an overwhelming, debilitating fatigue that's almost universal in MS. Over time, other issues like balance problems, muscle stiffness, bladder issues, and even changes in thinking or memory can also appear. Okay, so you've got this huge variety of symptoms, right? And they can come and go. This makes diagnosis a real puzzle. So how do doctors solve it? How do they arrive at a definitive diagnosis? Well, it's not a single blood test. It's really a careful, methodical process, like detective work, piecing together all the clues from a person's story, a detailed neurological exam, and crucially, from advanced imaging. And here is the absolute core principle of diagnosing MS. To be certain, we have to prove two things. First, that the damage is happening in at least two different places in the central nervous system. We call that dissemination in space. And second, we have to prove that the damage happened at different times. That's dissemination in time. This shows it's an ongoing process, not a one-off event. These rules are all laid out in what we call the McDonald criteria. And our number one tool for finding that proof? It's the MRI, or magnetic resonance imaging. It's an incredibly powerful scanner that lets us literally see the areas of demyelination inside the brain and spinal cord. They show up as these distinct bright white spots, or lesions. What's even more amazing is that we can use a special dye, called gadolinium, during the scan. This dye lights up areas of active inflammation, so we can see an old, quiet lesion and a brand new, active one on the same scan. That's how we can prove dissemination in time, right there in one picture. So once the diagnosis is confirmed, the conversation immediately shifts. It moves from what is this to what can we do about it? And this is where the story that's really hopeful. Because even though we don't have a cure for MS just yet, the way we treat it has been completely transformed over the last 20 years. It's a whole new world. So what's our action plan? Well, the treatment goals are really clear. First, when an acute attack or relapse happens, we want to hit it hard and fast to shorten it and make it less severe. Second, and this is the big one, for the long term, we want to prevent or at least reduce the number of future attacks. Third, we work on managing the day-to-day symptoms to improve quality of life. And the ultimate goal that ties all of this together? To slow down or even stop the progression of long-term disability. The main tools we use to achieve these long-term goals are a group of medications called disease-modifying therapies, or DMTs, and we have a lot of them now. They basically fall into different tiers of effectiveness, from moderately effective to highly effective. For a long time, the approach was to start with a milder drug and then step up if it wasn't working. But now, the evidence is really pointing us in a different direction. There's a growing movement to flip the pyramid, to start with a high-efficacy therapy right from the beginning. The idea is to gain control of the inflammation early and aggressively, which seems to lead to much better outcomes down the road. Now, with powerful medications come important safety considerations. Some of these high-efficacy therapies have a very small but very serious potential risk, a rare brain infection called PML. This is not something to take lightly, but it is something we can manage. Before starting one of these treatments, we always test for something called the JC virus. Knowing a person's status helps us calculate their individual risk. It's a critical part of the conversation between a person with MS and their doctor, making an informed decision together. Okay. So that brings us to our final section, the road ahead. Given everything we've talked about, the diagnosis, the new treatments, what does the prognosis look like? What can someone diagnosed with MS today realistically expect for their future?
This number here really tells the story. A clinically isolated syndrome, or CIS. That's basically what we call a person's first neurological episode that looks like MS. And look at this. Without any treatment, the evidence shows that a huge number, 60 to 80% of those individuals, will go on to have another attack and be formally diagnosed with MS within just 5 years. This statistic is exactly why we are so focused on diagnosing early and starting an effective treatment as soon as possible. It's all about changing that trajectory.
All right, let's wrap this up with the key takeaways. Point 1. MS is an autoimmune disease where the body attacks the protective myelin coating on nerves in the brain and spinal cord. Point 2. A diagnosis hinges on proving that this damage has occurred in different places and at different times. An MRI is our best tool to see that. Point 3. Treatment has a three-pronged approach, managing relapses, slowing the disease with DMTs, and controlling symptoms. And maybe the most important point of all, while MS is still a challenging lifelong condition, the outlook today is dramatically better than it used to be. Early diagnosis and modern effective treatments have truly changed the game. I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.